And now I'd like to invite up the school-based health centers from the Fort Peck Reservation. Kenny Smoker.
Thank you. You know, it's an honor. It's really quite an honor to be here and able to share what we've accomplished with very little resources. And with these very little resources, we're able to expand and help other tribes. It's like what I said, our children are our future, and we need to do everything we possibly can to help our children. My name is Kenny Smoker. I am the director of the Health Promotion Disease Prevention Program with the Fort Peck Tribes. And I've been doing this under contract with the tribe for about 14 years now. But our program started out with pretty much zero resources. We were given $5,400 to start this program. And this program now, we have roughly, I'll put in terms of employees, we have roughly about 120 employees. We're advertising and getting on board about 60 more employees. We're going to build a wellness center, which is going to employ about another 60 to 70 employees, and that's going to start next month. This honor alone has given us recognition from other organizations to move us along. And it's all about helping children and getting our people back on the right track. The school-based health program, what we do is we provide medical care, mental health, and dental care to our children in all school districts on the reservation. There's 5 of them. So it's one of our major tasks was recruiting these healthcare professionals into the school. So in the mental health side of things, we have psychiatrists, psychologists, licensed social workers, LCPCs, licensed addiction counselors, and mental health therapists to assist our children with a number of mental health and behavioral health problems that exist on the reservation. And believe me, there's a lot. And we still need probably about 20 more mental health staff in that area. So, and if you know where Fort Peck is, it's in a remote location in the state of Montana, probably in the country, probably one of the most remote places and hard to get to for recruitment and getting health services in our communities. On the medical side of things, we have physicians, we have pediatricians and family physicians. We also have nurse practitioners, nurses, CNAs, and other healthcare professionals like nutritionists that work in the schools. On the dental side of things, we have a dentist and dental hygienist. We have 5 dental hygienists addressing issues and cleaning teeth in the school. So last year, we've seen about 10,000 children out of about 2,500 children. So 10,000 encounters out of 2,500 children in all schools in the school system. And what's great about it is, we provide that service to all children, regardless of race, regardless of income, or the ability to pay. It's the children come into our clinics and they get the service. Where, some of the things that we're proud of, that we keep the children in the school. In some of our communities, they're about 40, 50 miles away from a healthcare facility. So they're able to get that service in the school, keep them in the school, but it also gives them some exposure to healthcare professionals. And one of the great things about it is we've had some of our students, high school students, graduate and go off to become nurses and hygienists and other healthcare professions that they're in now. So it's a great thing. One of the best thing I can say about the program is that we know for a fact that it saved 3 lives of children. And, without that service, I don't know what would happen, but there's, a number of children that we see throughout the year, and especially in the mental health area that's so needed, because there's, like most reservations, and I think a lot of you would agree with this, where we don't have the resources necessary to deal with these issues. And like Indian Health Service, they're only funded at 50%. From that poverty, a lot of these issues come about, so we're there to assist, and I think the great thing about our program, it doesn't take any tribal dollars, and the main thing, it saves lives and gives our children hope. Thank you.
Thanks, Penny. It's such an incredible program. It's a simple solution to a problem that so many of our nations and rural America really faces. How do you get children both in education and healthcare that they need? And by bringing it into schools is truly brilliant.